Hi, I'm Dave Fornell, the editor of Diagnostic and Interventional Cardiology magazine. I'm here at ACC 2012, and I want to discuss some of the new technology and trends that we've seen on the show floor. Among one of the most interesting product launches that we saw was the GE Discovery angiography system. It is a wheeled mount system that uses laser guidance, so it could actually wheel completely into the corner of a hybrid OR, and then you could wheel it in for an interventional procedure. And the laser guidance allows it to use all of the features that you would normally see on a fixed system, either a floor or ceiling mount, and it offers the flexibility of a mobile C-arm, but with much better image quality. New trends in software include two. One of them is a TAVR trans-aortic valve replacement guidance software shown by Siemens and GE, where the system integrates into its angiography system. The software could be used for evaluating patients using a CT data set or an MR data set to see whether they even qualify for the procedure. And then it could be used for procedural planning. It could also be used for procedural guidance on the angiography system, to where you can pick out views of the aortic root, and you could tell the system, I want to go to this position. It'll actually move the C-arm for that exact orientation. Several companies have released CVIS platforms for cardiology reporting and also bringing in additional modules. Among the companies that have launched brand new CVIS systems from scratch include GE, AGFA, and Philips. Let's take a look at some of these new technologies.
With the approval of the Edwards SAPIEN valve in November 2011, several vendors have created TAVR software to help screen patients, plan procedures, and then guide those procedures in the cath lab or the hybrid OR. Shown here is GE Healthcare's Valve Assist, which integrates with its Heart Vision software. This creates a 3D overlay on live angiography. Shown here is Siemens' introduction of its ZGO valve guide. This integrates with its angiography system. Both systems allow a CT or an MR dataset to be analyzed for precise measurements, including the coronary ostia, the lowest points of the aortic root, and the aortic annulus for sizing. During the procedure, both systems display a circle below the aortic root to enable a perfect cross-sectional view of the root for accurate valve alignment during deployment. Philips Healthcare and ACC partnered to create the Heart of Innovation exhibit on the show floor. It displayed medical technology from the past, present, and future, and among its highlights was the Corindus CorePath robotic navigation system for interventional procedures. This system is still under FDA review, but has gotten a lot of excitement at TCT and other meetings. Terumo recently purchased Onset and displayed its innovative introducer sheath on the show floor. The SoloPath introducer is stepped to enter the femoral artery is a 5.5 French device and then steps up to an outer diameter of 20.5 French. The device is inserted in a folded state and is expanded using a balloon inflation catheter. This allows for less vessel trauma when there is a need to introduce larger devices such as percutaneous valves or endovascular stent grafts. Once the procedure is over, the introducer sheath can actually be collapsed so it comes out with less trauma. One of the most innovative devices was the EMS Telemed ECG mitt, which allows fast 12-lead ECG using a glove which resembles an oven mitt. The mitt is laid across the patient's chest, and the contacts on there help make immediate contact so you don't actually have to put leads on the chest. The device is easy to use, and the company is seeking 510(k) for its use in home healthcare heart failure patient monitoring. Last but not least, the most popular display was probably the Hershey's chocolate booth, which gave away free samples and explained the heart-healthy benefits of chocolate.